But first, my thoughts at the end of day 28, America in shutdown. Now, over the past few weeks, our fellow citizens have learned a lot about the so-called experts. You know, the people who we're told are the standouts, the most learned professionals in their fields. Now, I'm talking about politics, in the media, and in science. Well, let's remember what we were hearing out of New York. This was just a few weeks ago. Politicians who made enormously expensive requests from the federal government based on data that turned out to be false.
All the projections say you could have an apex needing 140,000 beds and about 40,000 ventilators. We're following the data and the science, and that's what the data and the science says.
Those claims were based on the faulty models of the Imperial College of London study. And there were profound implications, trillions of dollars spent, based on the fear that those numbers were at least in the ballpark. We were told that the American hospital system was in danger of collapsing if we didn't flatten that curve. Well, the numbers weren't even close.
On behalf of downstate New York, we're in a position now where we're not going to need the ventilators. We're going to be okay equipment-wise. Unless things change dramatically.
No one who has needed a ventilator has not gotten a ventilator. No one who has needed a hospital bed has been denied a hospital bed.
Our hospitals were not overwhelmed and are not overwhelmed at this hour.
That is great news. It's 100% correct. The IHME model from the University of Washington has the latest numbers and projections. Now, right now, there is zero shortage of ICU beds and zero shortage of vents. The projected need for ventilators on the peak day is 14,407 nationally. That's nationally. For ICU beds, well, guess what? The numbers just killed the estimates originally. And by the way, another cost of these lame, panic-inducing models, it looks like we really didn't need the USS Mercy or the USS Comfort in New York or Los Angeles. Americans should be furious about this. Of course, the men and the women in these ships that are doing their patriotic duty, they're amazing. The commanders, amazing. But this is a lot of money that we're spending on a response that was based, again, on faulty numbers. Now, long before the government figured out that these fancy COVID-19 models were wrong, my own little team, little band of medical advisors and a few statisticians, they're a lot smarter than I am, insisted that they had also crunched the numbers. And this was weeks ago. They were making decisions, the people in charge, based on what my team said were wildly incorrect assumptions and ultimately incomplete data. So it was 18 days ago, on March 24th, I pressed Dr. Fauci on New York's specific ventilator and ICU bed requests. If the numbers are not right, then maybe that affects the decision-making about when the country can gradually get back to business.
You're absolutely right, Laura, and that's exactly right. FEMA is working closely with the state of New York to try and figure out exactly what they'll need at what time. I mean, if the totality is 30,000, what do they need now, next week, the week after? But you're right. Those kind of models do help inform us.
Well, it was kind of an answer, but non-answer. I mean, my question is, if my guys knew the numbers were wrong, they did, why didn't the experts know that the numbers were wrong as well? Why didn't we adjust our shutdown strategy given the huge readjustment in, for instance, that key number, the mortality number? Well, the president today indicated that he did suspect that Cuomo's requests were way too high, but he kicked into action anyway.
Fortunately, we don't need, just like we didn't need as many ventilators. When they were asking in New York for 40,000 ventilators, I had experts, these people, I listened to them. They said, you'll never need that many. And they were right.
Well, he was right. His instinct about that was right. And now the blame game, of course, has begun, because over the weekend, the New York Times attempted to make the case that Dr. Anthony Fauci and others, they were urging the president to shut down the country, I guess, earlier. Fauci said this to Jake Tapper.
You could logically say that if you had a process that was ongoing and you started mitigation earlier, you could have saved lives. Obviously, no one is going to deny that. If we had, right from the very beginning, shut everything down, it may have been a little bit different. But there was a lot of pushback about shutting things down back then.
What? He kind of clarified this at the press conference today, but what was he talking about there? At the end of February, he himself was saying publicly and presumably advising the president that there wasn't all that much to worry about. Watch.
Should we be changing our habits, and if so, how?
No, right now, at this moment, there is no need to change anything that you're doing on a day-by-day basis. You've got to watch out, because although the risk is low now, you don't need to change anything you're doing. When you start to see community spread, this could change.
Yeah. Well, based on these projections that, again, we've gone through week after week, were wrong, Fauci and others eventually did push for a national shutdown. And in places like New York, you can make the argument that that was necessary there. But now, and you look at all these other states, because tax revenues aren't coming in, again, beyond New York. New York is a case in and of itself here. Numbers are so bad there. But the states want more federal bailout money. Governors Larry Hogan of Maryland, Andrew Cuomo of New York, and a bunch of others are teaming up to demand $500 billion from the federal government. That's right, $500 billion, 11 zeros. The question is, where's that money going to come from? I guess we'll print it, we'll borrow it, and we'll end up weakening our country in the long run. Look for huge tax increases down the road to pay for all this, which, of course, will further hamper economic growth. Well, not that the media gives a darn. They're too busy trying to blame Trump for not locking down the country fast enough, even though his medical advisors had not yet suggested that. He spent part of his press conference today setting that record straight.
Because we're getting fake news, and I like to have it corrected. They're saying what a great job we're doing. And the media, these are the governors of California, governor of New Jersey, governor of New York. In New York, ventilators were going to be a problem. They didn't have a problem. Beds were going to be a problem. I mean, I'm happy about it. The Javits Center, which is incredible, is almost empty because they don't need them. That's good news, not bad news. All they did was took some clips and they just ran them for you. And the reason they did is to keep you honest. Now, I don't think that's going to work. It's not going to have any impact.
Well, the president's really frustrated, obviously. The media spin on all of this has been outrageous. All the while, they ignore the cost, of course, of the other costs that are piling up here. Medical procedures that people are putting off because they're afraid due to this crisis. The cost to our citizens' mental health because of forced isolation. The cost to family harmony, children's well-being being kept out of school. And, of course, the cost to our civil liberties. During the Easter weekend, liberal mayors and governors moved against people of faith in disturbing ways. In some places, even outdoor religious gatherings where people remained in their cars were in legal limbo, and they hinge on the whims of state and local officials. Mayor Greg Fisher of Louisville had his police harass churchgoers and who actually dared to attend services, again, in their cars. So if you sit in your car at a liquor store, you're fine, but not at a church. Now, a federal judge slapped him with a temporary restraining order. It was blistering. We're going to get to that in a moment. But I say it's time for Congress and for state legislatures to get back into session. If they truly believe these ongoing shutdowns beyond New York, beyond the hot spots, are necessary, then it's time for them to pass laws mandating them. Stop hiding behind emergency declarations for a virus that, while devastating, will probably, in the end, according to the new projections, take fewer lives of working Americans than heart disease or the flu. Get back to work so the rest of us can do the same, Congress. And those are my thoughts at the end of day 28, America in shutdown.